So this is the sensory system disorders. First, let's talk about blindness. So the loss of visual acuity that ranges from partial to total loss of sight. It may be congenital or acquired. And legal blindness refers to individuals with a maximum visual acuity of 2200. The degree of vision loss depends on the extent of trauma or disease. They will have diplopia, which is double vision, blurred vision, presence of floaters, or a loss of peripheral vision. For your assessment, so reports of blurred vision, double vision, loss of visual fields, and observations of the patient squinting while reading, rubbing the eyes frequently, or reporting pain in the eye. So medical management, they can wear contact lens, glasses, they can have assistive devices or guide dogs. And they're also going to need assistance with ambulation. So you want to precede the patient by about 1 foot, so you're just a little bit in front of them. And the patient's hand is on your elbow for security. And you also want to make sure you're describing the surroundings and letting them know, when to take a step up or if you're going to have to take a step down. So just letting them know while you're walking. Nursing interventions, you want to assess the patient's ability to perform self-care and provide assistance with ADLs as needed. You want to help promote independence. So just because they're blind doesn't mean that they can't function or help do a part of their self-care. So you want to encourage independence. You want to be aware of services and devices available for the visually impaired. So one of your major resources comes from the American Foundation for the Blind. And they also have Braille, which allows the patient to enjoy an improved quality of life. Nursing diagnosis for this one: fear related to visual loss or impairment, and risk for injury related to new and unfamiliar environments. So next, we're going to talk about refractory errors. So if you remember from A&P, refraction is just the bending of light as it enters the eyes. So your two major ones are myopia and hyperopia, and this is your nearsighted and farsighted. So with myopia, this patient, they can't see objects at a distance, and this is because the rays are focused in front of the retina. And with hyperopia, they can't see objects at a close range, and the rays are being brought into focus behind the retina. So just the difference between those two, you have nearsighted and farsighted. So to help correct this, they can be prescribed glasses or contacts. And they can also have the laser surgery known as LASIK. And this is where a corneal flap is folded back, and then the laser removes some of the internal layers of the cornea, as you see in the picture there. So nursing intervention, so after the corrective surgery, an eye patch is placed on the operative site until the next morning. The patient may be photosensitive and complain of blurred vision initially. Post-op visual checkups are scheduled at a 1 week and then monthly up for 6 months. You want to instruct the patient to stop wearing contact lens 1 to 2 weeks before the surgical evaluation. You want to encourage rest the first day post-op, and also let them know that visual acuity is not always 20/20 without glasses. So now we're going to talk about inflammation and infectious disorders of the eye. Your three main ones, you have your hordelum, chalazion, and blepharitis. And these are what we know as styes. So with hordelum, you have acute infection of the eyelid margin or sebaceous glands of the eyelashes. With the chalazion, you have inflammatory cyst of the gland at the eyelid margin. And with blepharitis, you have inflammation of eyelid margins, usually involving portion of the eyelid where the lashes grow. So to help treat this, they can be prescribed cephalexin and erythromycin. Those are your anti-infectives. They can also drain the cyst. You can put Warm normal saline compresses for 10 to 20 minutes, 2 to 4 times a day. And you can also do lid scrubs using no-tear baby shampoo. And that's really to help get out any of the crust or extra drainage that may be on the eyelids or around the eye. Nursing interventions, the primary objective is to prevent the spread of infection. So you're always going to push hand hygiene, let them know that they need to wash their hands before and after contact with the eye. And also that eye makeup should be replaced after an eye infection and every 3 to 6 months thereafter because of the potential for the makeup to harbor bacteria. So you have inflammation of the conjunctiva, that's the inner lining of the eyelid. So this is known as pink eye. It's usually transmitted from bacteria on the hands. The lids and lashes are cleansed of exudate with normal saline, and you can use cold compresses to help control edema, pruritus, and the inflammation. You have inflammation of the cornea. This is known as keratitis. It may result from injury, irritants, or bacterial infections. And in this patient, they're going to complain of severe eye pain, and it is the most common symptom that differentiates this disease from other inflammatory diseases. And surgical management, they can do the corneal transplant, which is known as keratoplasty. So now let's move on to dry eye disorders. So this is known as keratoconjunctivitis sicca. If the patient has associated dry mouth as well as dry eye, the patient may have primary Séjourne syndrome. The eyes may appear reddened or contain stringy mucus, and the patient complains of a sandy or gritty sensation that typically worsens during the day and is better in the morning after eye closure with sleep. So they're going to do what's called the Schirmer's test, and the test involves the placement of a filter paper in the lower lid of the eye, as you can see in the picture. And after 5 minutes, the paper is removed and the moisture on the paper is evaluated. Medical management, artificial tear replacement. They can be prescribed cyclosporine. It can increase tear production and reduce inflammation, but it may take 3 to 6 months for the medication to provide noticeable improvement. And you want to instruct the patient on installing eye medications, practicing appropriate hand and eye hygiene, and avoiding any irritants. Okay, so that's the end of part 1. In the next video, I'm going to go over the major disorders of the eye. So go ahead and click on to part 2 of your sensory video.